Welcome to This Explainer. Today, we're diving deep into the fascinating pharmacology hiding right there inside a routine trip to the dentist. We're going to look under the microscope at exactly what happens in your tissues when you get a numbing shot, and how very specific chemical partnership makes modern procedures entirely painless. Okay, so let's dive into this universal experience. Have you ever noticed your heart fluttering right after that shot? Well, we're uncovering the surprising chemical tag team that causes that and honestly makes modern pain relief possible. You see, in the world of pharmacology, adrenaline is essentially the Adele to local anesthetics. Just like Adele can take a simple melody and completely elevate it into a powerhouse masterpiece, adrenaline steps in and takes a standard local anesthetic, elevating its performance to truly extraordinary, long-lasting levels. It's literally the ultimate duet partner. But to really get why this partnership is so crucial, we need to look at the mechanics of the numbing agent itself. So, Section 1, How Local Anesthetics Work. Let's meet the main character of our story. According to the foundational pharmacology texts, local anesthetics are drugs that cause a reversible loss of sensory perception in a restricted area. Think of drugs like lidocaine, the most widely used one today. They target a highly specific spot to temporarily pause pain signals without knocking you out or messing with your central nervous system's overall consciousness. You're wide awake, but the pain just stops talking to your brain. But how exactly do they intercept that signal? Well, think of the drug acting like a bouncer at the door of a club, effectively blocking the cellular doors. As the concentration of the local anesthetic increases, it interacts directly with a receptor situated inside the voltage-sensitive sodium channels of your nerves. It decreases the rate of rise of the action potential by literally stopping sodium ions from entering the cell. Because the sodium can't rush in, the nerve's electrical depolarization fails to reach the necessary threshold. Boom! The pain impulse simply fails to fire. But our sodium channel bouncer faces a massive biological hurdle, bringing us to Section 2, the washout problem. Your body is a highly dynamic environment, right? When a tissue is inflamed, say you've got an infected tooth that's been throbbing for days, a couple of physiological changes happen. First, the inflammation lowers the pH of the tissue, meaning the anesthetic struggles to penetrate the nerve membrane. But more importantly, blood flow to that inflamed area is heavily increased. This increased blood flow acts like a rushing river, literally washing the anesthetic away from the injection site and into your systemic circulation way before it has time to establish a solid nerve block. So, how do pharmacologists fight against that rushing river of blood? That leads us right into Section 3. Adrenaline, the secret ingredient. Enter our secret ingredient, that powerhouse duet partner we talked about earlier. By mixing adrenaline, which is a really potent vasoconstrictor, directly into the local anesthetic solution in very precise, minute concentrations, pharmacologists totally solved the washout problem. When it's injected, adrenaline acts like an immediate barricade. It gets right to work activating specific receptors, primarily alpha-1 and alpha-2 receptors, located in the walls of your blood vessels. This activation causes the local arterioles to constrict, significantly narrowing those blood vessels. With the blood flow bottlenecked, that rushing river slows to a tiny trickle, and the anesthetic is effectively trapped right at the site, giving it all the time it needs to block those sodium channels. This bottleneck effect creates a cascade of incredible physiological advantages. Let's look at Section 4, 4 major benefits. By simply trapping the drug locally, adrenaline delivers 4 massive wins. First, it prolongs the duration of the action, meaning your numbness lasts way longer. Second, it enhances the intensity of the nerve block, ensuring absolute pain relief. Third, and this is absolutely crucial for safety, it reduces systemic toxicity. Because the drug's absorption into your wider bloodstream is slowed down, your liver actually has the time to metabolize it properly, keeping plasma concentrations safely low. And finally, by constricting those blood vessels, it provides a much more bloodless field, keeping the surgeon's or dentist's view perfectly clear. And this brings us to a very specific number you'll find in almost every single dental clinic, 1 to 80,000. This is the precise concentration of adrenaline commonly mixed with 2% lidocaine in a standard 1.5 milliliter dental cartridge. It is the exact, scientifically calibrated reason your mouth stays wonderfully numb for hours after a filling, rather than wearing off in just a few fleeting minutes. But completely restricting blood flow comes with a serious catch. Let's jump to Section 5, the danger zones. While adrenaline is a miracle worker in your gums, it can be incredibly dangerous in your extremities. These specific parts of the body, like your hands, feet, fingers, toes, the penis, and the pinna of the ear, they have a very limited secondary or collateral blood supply. If you inject a potent vasoconstrictor into these areas, you can completely starve the tissue of oxygen. This drastically increases the chances of local tissue edema and severe necrosis, which is where the tissue literally begins to die. So in these specific zones, the anesthetic must absolutely work solo. Furthermore, a patient's own systemic health has to be considered. If this adrenaline accidentally hits the systemic circulation, which, can happen if a blood vessel is nicked during the injection, it can dangerously spike blood pressure or trigger rapid heartbeats. This is exactly why doctors must carefully screen your medical history. Adrenaline-assisted anesthetics are generally avoided in patients with ischemic heart disease, uncontrolled hypertension, or thyrotoxicosis, which is an overactive thyroid condition. Also, if a patient is taking certain medications like beta blockers, the interaction can lead to a severe, unopposed spike in blood pressure. As we near the end of our explainer, we arrive at Section 6, a delicate balancing act. Without its partner, a local anesthetic really struggles against the body's natural blood flow, resulting in a short duration and higher risks of being washed right into the broader system where it can cause toxicity. But with adrenaline, it achieves perfectly localized and safe precision. The adrenaline acts as the ultimate supporting character, setting the stage so the anesthetic can do its job flawlessly. So I'll leave you to ponder this incredible pharmacological teamwork. Does the true success of a medical treatment rely just as much on the chemical assistance as it does on the active drug itself? It really makes you realize that medicine isn't just about single heroic drugs, but about brilliant chemical pairings. I hope this sparks a brand new appreciation for the science happening just under your skin the next time you sit back, relax, and let the ultimate duet, the Adele of pharmacology, go to work.